Military Occupational Specialty, Preventive Medicine Specialist, a major contributor to the prevention of infection and disease. As a preventive medicine specialist, the Army will train you to inspect and recommend proper corrective action on environmental and sanitation conditions that could affect soldiers' health. You will train to collect and analyze water to ensure water quality standards are maintained, to operate a water analysis kit to determine the concentration of various chemicals in water, and to use a bacteriological test kit to detect harmful microorganisms. You will train to conduct surveillance by collecting insects and rodents, identifying them, determining if they are a threat to the community, and, if necessary, implementing proper control measures. Upon graduation, you will be assigned to a regional medical center or to a preventive medicine detachment. As a preventive medicine specialist, your duties may include inspecting field and garrison dining facilities to ensure food is prepared and served under sanitary conditions. You may also be assigned to inspect other facilities such as barber shops and beauty shops, gyms, swimming pools, and child care centers to ensure they meet sanitation standards set by the Army and federal government. As a preventive medicine specialist, you may collect environmental samples of soil, air, and water. For example, you will monitor water production and purification to determine the health risks posed by harmful chemical and bacteriological contaminants. You may be assigned to a preventive medicine team in the field, where it will be your responsibility to detect unsanitary or dangerous conditions, which involve solid, liquid, and human waste, and recommend ways to correct them. Your duties may include supporting your unit in peacekeeping, homeland security, and combat operations. Also, preventive medicine specialists are members of the Army disaster and humanitarian teams, trained to respond to emergencies at a moment's notice. The training and experience you gain while serving in this specialty can help you transition into the civilian employment sector. Public health inspectors, environmental health technicians, industrial hygiene technicians, and pesticide applicators are crucial assets in the civilian workforce. Preventive Medicine Specialist, preventing disease as part of the Army Healthcare Team's continuing effort to conserve the fighting strength. Army Medicine, bringing value, inspiring trust. Military Occupational Specialty, Animal Care Specialist, concerned with the prevention of disease in animals by providing them care and treatment. As an animal care specialist, the Army will train you to assist a Veterinary Corps officer to provide medical and surgical care for pets and military working dogs, including those that support special operations, combat trackers, and mine detection. You will be taught to administer immunizations and medications, learn techniques for restraining animals prior to exam and treatment. You will be trained to collect blood, urine, and fecal specimens, perform skin scrapings, ear swabs, collect post-mortem tissue specimens for lab submission, and conduct routine lab tests, such as cytology and parasite identification. Upon graduation from this specialty, you may be assigned to a veterinary clinic a research facility, or a field unit. Because the animal care specialist supports the Department of Defense, you may be assigned to any military installation or research lab worldwide, supporting research protocols and the development of vaccines. Your duties may include taking x-rays and assisting in surgery, post-operative care, and in the euthanasia of animals. As an animal care specialist, you are responsible for the day-to-day functions of the veterinary facility, such as managing electronic animal health records and the rabies surveillance program. You may order, receive, and monitor supplies and pharmaceuticals using a web-based system and ensure the sanitary conditions of the veterinary facility. Your duties will also include supporting your unit in humanitarian, peacekeeping, homeland security, and military operations. The training and experience you gain while serving in this specialty can help prepare you for civilian employment as a veterinary technician or a laboratory animal technician. The Animal Care Specialist, a compelling specialty and an integral part of the Army Medical Department and Department of Defense veterinary missions, which provide full-spectrum services and play an important role in military operational success, bringing value and inspiring trust.
Medical laboratory specialists play a crucial role as part of the Army medical team by collecting, processing, and testing tissue, blood, and the body fluids of patients. This career field requires individuals who have met minimal education requirements in the areas of biology, chemistry, and algebra. You must have manual dexterity and no aversion to the sight of blood or needles. And an ability to precisely follow detailed procedures.
Laboratorians require a couple of different characteristics. One of those being patience. You have to be able to work through the problems that are presented by the patient because you have a lot of unknowns. I would also say due diligence. You have to be willing to sit down and really work throughout all the problems. But most importantly, I think you have to work autonomously. A lot of times you're unsupervised there on the bench, and you require the skill set that you learn in school, and you have to apply that skill set to make sure that you're making the right calls or the right diagnosis for the doctors to then treat those patients.
After successfully completing Army Basic Combat Training, you will attend 52 weeks of advanced individual training at Fort Sam Houston, Texas, to include a residency at a major military hospital laboratory, where you will perform elementary blood banking and clinical laboratory procedures in hematology, immunohematology, clinical chemistry, serology, bacteriology, parasitology, and urinalysis. You will be responsible for collecting blood specimens by venipuncture and capillary puncture, along with packing, unpacking, inspecting, storing, and distributing blood and blood products, and assembling, disassembling, and maintaining laboratory equipment. Following successful completion of all required training, you will be eligible for assignments at military hospitals located around the world or a military research laboratory.
I appreciated that I was able to get paid to go to school while learning a very valuable career path that whether I wanted to stay in or get out, I was going to be able to continue to have a good life after the fact.
I chose the medical laboratory specialist field because I had just came out of college and I thought that I wanted to become a doctor, and all the information that I got when I did my research pointed to medical laboratory specialist as a really good foundation. A doctor can't do his or her job without us.
As a soldier, you will also have the opportunity to further your military and civilian education with additional specialized training or through college courses. Your military experience can help you in your transition from the military to the civilian workforce, where you may pursue a career with privately owned laboratories, hospitals, clinics, or research institutions. Aiding in the diagnosis, treatment, and prevention of disease are the Army's medical laboratory specialists.
Military Occupational Specialty, Practical Nursing Specialist. As an Army Practical Nursing Specialist, you will have the opportunity to make a direct contribution to improve the well-being of those who are truly in need. You will be providing the highest level of quality medical care to our nation's soldiers, veterans, and their family members, from infants to seniors. Practical nursing specialists serve in a variety of medical treatment facilities throughout the world, or deploy in combat, peacekeeping, or humanitarian operations. This Army career requires individuals who are service-oriented and are willing to learn more about themselves, are exceptional communicators, and have a deep sense of professionalism and compassion while caring for the lives of others. To succeed as an Army Practical Nursing Specialist, you should have an interest in and understanding of chemistry, biology, general science, and algebra. Be action-oriented with a caring temperament and a strong ability to empathize with patients. You should have strong interpersonal skills, with the ability to communicate effectively with a high sense of responsibility, attention to detail, and the ability to perform your duties while remaining calm under pressure. Practical Nursing Specialist Advanced Individual Training consists of 51 weeks of intensive classroom, field, and clinical instruction, with testing in 2 distinct phases. After completing Army Basic Combat Training, you will begin Phase 1 of Advanced Individual Training at Fort Sam Houston, Texas. Phase 1 consists of an intensive 11-week introductory phase to Army Practical Nursing in both classroom and field settings. In Phase 1, you will receive instruction and testing on basic nursing skills, the duties and responsibilities of practical nurses, basic science for practical nurses, to include the cardiac and pulmonary systems, nutrition, microbiology, pharmacology, physiology, pathophysiology, and field nursing. You will also receive training on computer-based communication and information systems used in Army medical patient care documentation and tracking.
The pace of this course is difficult, to say the least. A lot of civilians go through the same course in 2 years, and we do it in a year. And we do it while also being a soldier. It's the best MOS in the entire Army.
After successfully completing Phase 1, you will relocate to one of 5 Army hospital training sites for 40 weeks of Phase 2 of your training. Phase 2 consists of medical, surgical, didactic, hands-on training, and integrated classroom instruction with multiple skills laboratories and testing for each block of instruction, followed by a final graded medical examination. In Phase 2, you will learn how to perform duties such as preventive, therapeutic, emergency, and routine patient care, administering medication prescribed by a physician, assessing the patient's current condition and monitoring changes, obtaining vital signs such as blood pressure, temperature, and weight, cleaning, irrigating, and bandaging wounds, providing immunizations and recording medical history, managing IVs, coordinating patient discharge, supervising nursing assistants, observing fluid and food intake, and the transporting and release of patients. While being supervised and observed by instructors, you will also spend time working directly with hospital staff members in rotations through various patient care areas to include medical surgical, ICU, and OBGYN.
Just remember that at the end of this, You're going to have your license, you're going to be a soldier, you're going to be helping other soldiers and their families, and it's very rewarding.
At the completion of your training, you will be required to pass the Texas Board of Nursing National Clinical Licensure Examination, after which you will be awarded the Military Occupational Specialty Practical Nursing Specialist. As a soldier and licensed practical nurse, you will also have the opportunity to further your military and civilian education with additional specialized training or through college courses, which will help you in your transition from the military to the civilian workforce as a licensed practical nurse. Bringing the gift of care, Military Occupational Specialty, Practical Nursing Specialist.
This course, it sets you up for life. It's a career. You get a license from this job. You're not only getting paid, you're also getting paid to do something that is beneficial to you. It would help you help others. And I don't know what feeling beats that, helping others.